blood pressure or hypertension is when your blood pressure, which is the force of blood flowing through your vessels, is consistently too high. This is above 140/90 millimeters of mercury or higher. Hypertensive emergencies are diagnosed if there is a systolic blood pressure higher than 180 millimeters of mercury or a diastolic blood pressure higher than 120 millimeters of mercury with the presence of acute target organ damage. The brain's blood supply is provided by internal carotid and vertebral arteries, which originate in the neck and ascend to the skull base. The anterior and middle cerebral arteries form the brain's anterior circulation. The basilar artery originates from the fusion of the right and left vertebral arteries at the caudal pontine margin and bifurcates into two posterior cerebral arteries. The posterior communicating arteries connect the internal carotid and posterior cerebral arteries, completing the cerebral arterial circle of Willis. The blood-brain barrier, BBB, separates the peripheral and central nervous system circulation. It consists of endothelial cells, astrocytes, pericytes, microglia, and glia limitans, a membrane that hinders solute movement across the blood-brain barrier. Angiotensin receptors make the BBB sensitive to the effects of renin and aldosterone-angiotensin system, mediating endocrine regulation of water and electrolyte balance, vascular resistance, oxidative stress, neuroinflammation, and brain homeostasis. Hypertensive emergencies are life-threatening conditions resulting from markedly elevated blood pressure, which can lead to end organ damage, pulmonary edema, cardiac ischemic events, acute renal failure, aortic dissection, eclampsia, retinopathy, encephalopathy, and intracranial hemorrhage. Hypertensive encephalopathy is an uncommon hypertensive emergency manifestation with symptoms such as severe headaches, nausea, vomiting, visual disturbances, seizures, and mental status changes. Early recognition and treatment improves clinical outcomes. The brain maintains blood flow within a normal range of perfusion pressure, CPP, and mean arterial pressure, MAP, with CPP typically between 50 to 150 millimeters of mercury in healthy individuals. Autoregulation-induced cerebral blood flow alterations invoke various mechanisms, including neurogenic, myogenic, endothelial, and metabolic responses. Cerebral arteriolar vasoconstriction occurs with MAP elevation, while arteriolar dilation maintains CPP. However, sudden arterial pressure increases can overwhelm this autoregulation mechanism, leading to cerebral edema, brain damage, and neurologic deficits. Chronic hypertension induces adaptation in the cerebral vasculature, such as arteriolar hypertrophy, allowing for a higher autoregulatory range. Acute hypertensive episodes can induce hypertensive encephalopathy at diastolic pressures as low as 100 millimeters of mercury, often seen in patients with eclampsia or receiving cytotoxic and immunosuppressive therapies.